Since its establishment in 1927, the Royal Australasian College of Surgeons has been the leading advocate for surgical standards, professionalism and surgical education in Australia and New Zealand. The RACS Global Health vision is that safe, affordable, quality surgical and anaesthetic healthcare is available and accessible to everyone. The RACS Global Health team engage specialised surgical, medical, nursing and allied health professionals who donate their time and services to deliver the Global Health program across 14 countries in the Indo-Pacific region.
Well, I think the impacts upon the communities that we serve, on the face of it, the obvious one is the effect on the patients. So a lot of the teams that go out are providing services that can't be provided by the local countries for various reasons.
You do a trip and you're there for a week or two, you obviously have a role in it over that time in fixing people and treating people and managing conditions. But if you also take the time to educate and to train and work with people in collaboration there, they can continue the work that you have started, help manage the patient. And a successful trip is one where you establish or renew relationships with local surgeons and staff.
I've faced a number of clinical challenges while volunteering in RACS activities overseas.
The system is different, the environment is different, the working culture is different.
As you build trust with the locals and you understand their systems, it becomes a lot easier. And really, it becomes very rewarding to actually get through the day successfully, having met those challenges.
We are grateful to our more than 200 specialist volunteers, many of whom have established long-term relationships with Pacifica clinicians and have themselves enabled and strengthened the clinical capacity of the national health systems in which we work.
This also gives us the opportunity to get involved in capacity building and training, which I think is another really important benefit. So sometimes the benefits on the communities aren't really, apart from the immediate patient benefits, aren't seen for some years, but relationships are forged, training is developed, and young clinicians in particular are mentored to go on to further training and become leaders in their field in their own countries.
The Pacific region is at a critical juncture in its transformation to long-term development and establishing effective strategies for implementing strong and stable health systems. RACS recognises that a key to a healthy future in the Pacific is strengthening the region's health system to build workforce capacity and enable universal health coverage.
The RACS Global Health work is really important to our partners in the Pacific. It's important because of the way that RACS Global Health approaches our work. They're not just clinical service trips. They're trips that are aimed at working with partners to develop the future.
And we're able to build capacity and we are able to strengthen their healthcare system and help them to be independent and look after their community.
And it's providing healthcare to a part of the world which is tremendously under-resourced. And I think if we've got the opportunity to do that and the resources that enable us to do that, we should make the most of that.
RACS Global Health has a theory of change to improve access to health and surgical care across 4 thematic areas. We believe that by improving patient access, building workforce capacity, strengthening health systems, and advocating for sustainable action in global health, we can bring about lasting change to improve access to quality health services across the Indo-Pacific region.
So if you're a new volunteer going on your first trip overseas, you're going to be very enthusiastic. You're going to want to see results and look after as many patients as you can, and that's natural.
And it's important to bring all of that skill and expertise and enthusiasm with you, but it's also important to leave a few things behind.
Be patient and work at the pace of the host country healthcare workers. It's going to be at a very different pace to the pace that you're used to. But most people find that very rewarding when they adapt to these situations. There's a lot of supports for you too.
RACS has got the infrastructure and the experienced staff that have worked in all sorts of programs, which means when you arrive as a member of the team, you can basically get straight down to work. You can start establish relationships with the team knowing that all of the logistics has been sorted out.
It's very satisfying to go off on a well-run trip that's well supported, with a great team, and to meet locals who are keen to meet you, keen to work with you.
The impact to the patient, it's enormous. We think it is, something simple, but the smile tells the story, how beautiful it is, that's very positive, helping another human being, yeah.